So welcome to this presentation on artificial intelligence, leveraging artificial intelligence for smarter clinical and community pharmacy practice. We are going to look at it from different angles anyway. And my name is Gabriel Gambo Madu. I'm the founder of AI Mastery Academy. It's my pleasure to be speaking to you on this subject matter, an area where I'm passionate about. In actual fact, that is one of my core areas of practice as an individual. Although I practice as pharmacists in public health supply chain. But here we're discussing how we can use AI in our practice as pharmacists. And just like the PRO introduced earlier, is the new trend, and it has actually comes to stay, and we're going to see how this has been active in several different areas. So what is the new reality in pharmacy? There's a challenge in our practice. For depending on where you are practicing, whether in the hospital or in the community, you could see that there's rising number of patients. The volume of patients we see daily is increasing, and there's a lot of data with more people coming in. That leads us to both patient overload and data overload. Now we need to find a way of managing it, especially that we have limited number of personnel to handle this matter. Secondly, there's a pressure for faster and evidence-based decision making. So it's not something that you just take all your time. We have a lot of, especially if I, for example, in the community, not community practice now, in the hospital practice where there are very few pharmacists to attend to a whole lot of patients, you don't have the luxury of time to even do the pharmaceutical care which you want to do. So you want to get every information at the tip of your finger. And as it were, as humans, we have a limitation to what our brain can reproduce. AI has now come to help us. So we are at a time that the demand for quick decision making is very high. Then a lot of activities that we do in our practices are manual. Okay, we need to, whatever record keeping, everything we do is manually done. So the implication of that, therefore, is it takes a lot of time. We have to do repetitive tasks and so on and so forth, and it can be tasking on us as pharmacists in delivering our services. Okay, but what do we want to achieve? That is the shift we are looking at. We want to move from manual overflow, manual workflow, all those things that are drawing us back and overwhelming us, to an intelligent data-driven practice, a practice where we don't necessarily have to do a lot of things manually. We can get technology to help us to bring the change that we so much desire and able to deliver our services in such a way that it is optimally useful to our patients. That's where we are going to. Okay? And now, how can we achieve that? One of the critical ways, and of course, what is available to us now to do that is artificial intelligence. So artificial intelligence helps solve data fatigue problem by filtering the noise, letting you focus on what really matters, which actually is patient outcomes. So all the things that are taking a lot of your time, which may not directly impact on patient outcome, we are shifting it to AI. Let AI take care of that so that we can do that most important thing, which requires our own judgment as professionals. And that's what we are going to look at in this discussion. So now, generally, globally, what is happening in the area of healthcare as well as pharmacy? Of course, pharmacy is a part of the healthcare system. What is the transformation that is happening as a result of AI? Drug discovery is an area which is highly impacted by AI. Now, if we go back to drug development, what we studied in school, whether through pharmaceutical chemistry or through pharmacognosy, you know, we have several candidates for the drug development process. Then we move from so many candidates, we narrow down to a certain number. Then we get to the stage where we get to even animal trial. Before we now get to the stage, we get to human trial. Then finally, we have a moiety that can be regarded as a drug. This takes a lot of time. This takes a lot of personnel. This takes a lot of money. Today, with AI, you can screen out a lot of these candidates without entering the lab. And what you are using is information, data available for several other things in relation to whatever moiety that you are testing. So instead of spending years for drug development, today, drugs that can be developed as quickly as possible. That's another impact. That's a transformation that AI is bringing into our practice in healthcare as well as in pharmacy. How about hospital systems? Humans may actually make mistakes. We actually make mistakes. Of course, AI makes mistakes. But the level at which humans make mistakes is so alarming. I mean, and this mistake will come from several different things. It could be forgetfulness, it could be stress, it could be several different things. So medication errors occur, and this could lead to morbidity or mortality of our patients. With AI, medication errors are reduced significantly because you are able to reach this information as quickly as possible. You are able to feed in information, and it will give you correlations and relationships between the condition and whatever medication you are giving, and a lot more. So in the area of hospital systems, as it relates to medication errors, this AI has helped to reduce it. And that's a global trend. In the same way, service delivery in the hospitals have improved. A lot of things that have been done manually are now automated, and because they are automated, service is delivered better, faster, and even cheaper. Okay? Then how about in our community practice? AI too is impacting in several different ways. It's impacting in delivering of services, it's impacting even in the management of the community practice. So patient demand can be forecasted now based on data available to the pharmacy, and you can optimize them. So stock out can be reduced or is reduced. Expiries are also reduced. You can forecast what is the consumption or what type of patients come to your pharmacy. You can get all this information just by touching the button, or even just for a simple report, because AI goes through the data, looks at the trend, and gives you the report. That is AI also impacting community practice. AI is impacting several different areas as it relates to pharmacy practice, including patient education, which we are going to see as we go on in this discussion. Now, AI literacy is rapidly becoming a professional edge. I read today about 30,000 workers were laid off in Amazon. And most of these people who are laid off do not have AI skill. Most of the people that were laid off do not have AI skill. Today, if you do, there was a time that what you need was computer skills. Those who have computer skill are always ahead of those that do not. Today, it has moved from just computer skills, it has moved to AI skill. If you do not have AI skill, those who have AI skill will come and overtake you. You may lose opportunities if you don't have AI skill. So, and this is an area which you need to develop and to give you an edge. There are things that will take you 2 hours, 3 hours, 5 hours to do. With AI, you can get this done in minutes. That's an edge that you have over several other people that do not have the skill. And I'm sure you want to get that. You need to begin to work towards that area of seeing how you can use AI to improve your professional delivery as well as your capacity. Now, hospitals now use predictive analytics to anticipate antibiotic shortages before they occur, improving patient care and reducing waste. These are just an example of how AI is impacting hospital systems, which I mentioned earlier. This same thing also happens at community level. Like I said, it can reduce stock out, it can reduce expiry, and so on and so forth. Now, there's this controversy. AI is coming, AI will replace you. AI is coming, AI will replace you. The truth is AI will not replace you. AI is inanimate. It's not a person. It's just a technology. So AI did not come to replace you. What does it come to do? It came to automate the repetitive tasks that you have, all the data entries that you do, all the data analysis that you do, all the entries that you do, all the information that you gather. AI has come to automate it. Okay? So it does not automate your clinical judgment. You are still needed in the process. You are still needed in the process. Irrespective of whatever information that AI gives you, you have the last say as per what you want to do. So you see, AI is not there to replace you. It's here to enhance your work. AI can also not replace your human empathy, even though it can think and it can reason and it can do a lot of things. So it didn't come to replace you. It's also here to assist you with your clinical reasoning. Now you have several options that you may not ordinarily think of when you are trying to make a decision. It gives you different angles to it so that using your own expertise and judgment, you can now decide on what you want to do in your clinical practice. That also solidifies the fact that AI did not come to replace you. But here's the real question. And let me make this statement. Pharmacists who use AI will replace those who don't. So you see, it is not the AI that will replace. It is the empowerment that AI gives somebody that that person is going to replace you. So if you do not have AI skill or AI knowledge and cannot use AI, another pharmacist who knows how to do that will replace you. Okay? So in essence, you need to build that skill. Let me go back to history. I'm sure many of us, I don't know how many of us were around then when people were using typewriter. I'm sure many of us didn't see it in active, very active. Many of you are born into the computer age, maybe. When the computer came, many people who are typists, who did not like the typing skill, lost their jobs. Is it computer that replaced them? No. Those people that know how to use computer that replaced them. And today, you and I do not need the services of a typist. In government organizations, they don't have a typist anymore. Everybody prepares his document. You see how people who know how to use things will replace those that don't know how to use it. The typists who saw the opportunity and moved themselves into using computer were not replaced. They just changed role. So the same thing will happen to you as a pharmacist. So the question is, how will you leverage it for better patient outcome? How you leverage AI for better patient outcome is what will make you significant, what will make you irreplaceable, what will make you outstanding in your practice. 2 days back, I was speaking to staff of NAFDAC in Lagos, and I told one of the things we talked about is how can you be irreplaceable? How can you be irreplaceable? I just told you about 30,000 staff that were laid off because they lack AI skill. You can also be laid off if you lack AI skill. So how should you not be replaced? It's learning this skill and now combining it with your human intellect, with your judgment, with your expertise as pharmacists, so that you can make a difference. And it's very, very important. And I'm happy that according to the president, you discussed sometime in April, and now we are discussing it again. Now, this matter is repeating itself because of its importance. All right. So now let's go back. What is AI actually? What really is this AI? Of course, AI stands for artificial intelligence. Then what is artificial intelligence? Simple. It's machines mimicking human thinking, learning from data, reasoning through problems, and predicting outcomes. That is AI. Now, AI is not just ChatGPT. Let's clear that clear. Of course, what we're going to do in this class is generative AI, on which ChatGPT is part of it. But some people, when you talk of AI, they just think that ChatGPT is just one AI tool. In actual fact, it's one AI tool in a division of AI, which is called generative AI. And AI has always been there. AI didn't come on November 30th, 2022, when ChatGPT was released. It's just that it became available to the common man. That's the difference. There's a revolution in AI usage, and that's what happened. If you go to history, it started since 1950s. It went through different stages to an extent we even had an AI winter. An AI winter means that everything was quiet about AI. Development was slow, but actually going on. Then recently, it got more funding, more attention. A lot of work went into it and it blew. And that's what we have today. Okay, so AI did not just start a few years ago. AI has always been there. Okay, now, so when we say machines are mimicking humans, what does that mean? So humans can see, machines can now see. How many of you have opened any account with the fintech? They tell you to take a picture, right? That is you put your BVN, then you take a picture. That is computer seeing you and comparing it to information that comes from your BVN that was uploaded. Is that not what you do? Maybe let's look. Maybe you want to board a plane. You say you bring your ID. They look at your ID. They look at your face to be sure that you are the one that's in the ID. Is that not seen? That's computer also seeing. Now I'm talking now. You also talk. Every human talk. Computers also talk. I hear, you hear, computers also hear. So you can speak to computer and it will respond to you and give you the whatever it is that you ask of it. That is making human. Now, something that differentiates human from several other beings is the ability to think. And now computers can think. That is artificial intelligence at work. However, even with all this capability, it still cannot replace you because there are some parts that you have that it doesn't have. Empathy, creativity, care, feeling, and all those ones that you have, it doesn't have it. However, if you don't have it, if you don't use this skill, you don't use the AI, somebody who knows how to use it will replace you. That is an extra weapon. That's an extra weapon. I have always, I started teaching AI since 2022, immediately after ChatGPT came out. And I tell people, don't fight it. Some people are out to fight it. Recently, when YouTube did some upgrade, some people are happier. They're going to stop AI videos and everything. No. In other fact, how can Google create a tool that creates video and say YouTube cannot use it when you are the owner? Imagine. People are trying to fight. Don't fight it. You need to learn it, understand it, and find out how can I use for myself. Some people say AI will make you lazy. It is not true. Calculator did not make you lazy. Calculator freed your brain so that you can do more. The plow and tractor freed the farmer's energy so that he can live better health. The same thing is happening with AI. AI has come to help you, not to make you lazy, not to replace you. But if you don't use it, I keep emphasizing this, someone who uses it will replace you. So this I want you to AI as an assistant, as a collaborator. So imagine, many of you have done your internship. That's why you're now members of YPG. So imagine that now there are some interns in your pharmacy. And this intern never sleeps. This intern understands everything about dispensing, everything the time you want. So AI is that tool that is knowledgeable in several different things, many times beyond even what you could easily remember or even know. Then you use his own knowledge to help you. So as a senior pharmacist, 2 years, 5 years, 10 years, depending on the number of years you have been in practice, if you have an intern that can do a lot of work for you, use that intern maximally. That's how I want you to look at AI as an intern for you. Okay? So, for example, ChatGPT has learned from a lot of literature and now can answer clinical questions as a trusted colleague instantly and very, very accessible. Okay? So if you look at it from that point of view, then you don't need to fight it. You look at it as something that will help you in your journey. So this is how AI works. Let's look at the pharmacy framework, how AI works, and the clinical impact of what it does. Okay? So we said AI learns. Okay? What does that mean? It means it studies drug interaction, for example, electronic health records, clinical literature, and so on. And what's the impact of AI learning? It now builds knowledge base continuously, which now is available to you to query and ask questions and get information. We said AI can reason. What does that mean? It means clinical inference. It can look at all the data it has available and come up with a combination of different things. Let's look at you. Now, when you make judgment, what do? You're using, okay, if this is this and this is this and this is that, then this must be this. That is reasoning. Okay, so if AI now reasons and is able to look at clinical inferences and select optimal therapy, you can use it to support evidence-based decision making. AI predicts, can tell you what could happen if this is this and that is that. So what does it do? It can forecast patient outcome and adherence based on the data available to it. And what can you use that for? You can use it to enable proactive intervention. Okay? You can use it. Now we're talking about personality medicine. You can predict what is likely to happen. Okay? Then how about pattern recognition? AI does that quite a lot. So what does that mean? It can identify medication errors. And if AI can identify medication error, what's the implication for you as a clinician? It strengthens safety systems. So your level of making mistake in area of medication error becomes less and less and less because AI has some capability that you can use in your practice. So you see how it assists us in our practice as pharmacists. Now, there are different types of AI. Tonight, we are going to be talking about one of them, but there are many of them. I just mentioned some of them. One, predictive AI. What does it do? It forecasts. Just like we say prediction. It forecasts what is likely to happen. With disease, how would the disease progress based on the information available? What is the adherence pattern for a particular patient, for example? What are the patient risks that you may have, and how do you manage it? That's predictive AI. Then we have analytical AI. What does it do? It analyzes data. So it can process clinical notes, lab results, electronic health record data, and extract actionable insight for patient care. So, for example, you can, let's say a doctor has information about a patient over time. You can feed those information into AI, and AI will analyze those information and tell you what is happening, and tell you what is likely to happen, and tell you what you need to do to stall what is likely to happen. That's analytics. You can also use it in your pharmacy business. For example, you can input all information about your patient type or information about your inventory and everything, and you can take ChatGPT or any of the tools that you are using to analyze it. It analyzes it and brings you information. Remember earlier I said, with AI, you can decide what type of patients come to your pharmacy, which drug sells the most, so that you rule out, stock out, and reduce expiry and stuff like that. This is analysis. That was come from analytic AI. Then we have generative AI. Generative AI come up with information, something new. It creates patient education content, drug summaries, clinical documentations in seconds. In actual fact, it answers a lot of questions that you have whenever you query it. That generative AI. And that's what we're going to do this evening. I'm going to see one or two of them in action. Then we have conversational AI. Conversational AI are chatbots and voice assistants providing real-time clinical information and patient support. Now, I'll give you an example with UBA. I think Zenith Bank also have something similar. UBA has what is called Leo. You can chat with Leo to discuss several different things. You can chat with Leo to discuss several different things, and Leo will give you all necessary information. You can have a particular problem with your account and you ask Leo, and Leo will give you answers. And Leo is not human. That is a chatbot. It's a conversational AI. What did you do? What did they do? They fed a lot of information into that, all this necessary scenario and so on and so forth, and is able to go into, by recognizing pattern. Remember, I mentioned pattern recognition, by recognizing pattern and coming up with answer that could be. And by the way, thank God you are a scientist. This is a result of mathematics, what is called algorithm. Okay? And these things are, of course, some people think that AI is a computer science something. No, AI is a multidisciplinary team, including neuroscientists, clinicians, name everybody, a lot of roles are involved, including computer engineers and even computer scientists. So it's not a computer science thing. It is a multidisciplinary. Neuroscience, because this has to do with thinking. It has to do, even psychologists are there and so on and so forth. Okay. All right. So we have an example. Google has what is called MedPalm. MedPalm is Google Medical AI. We might exactly see it as we go on. And it answers complex clinical questions with step-by-step reasoning, mimicking consultant-level pharmacy practice. So now we have consultants as pharmacists. That level of knowledge that you use to answer questions, this AI has that capacity and capability to answer questions. So you see how AI can now come to your rescue quickly. Because you consult AI does not mean that you are less intelligent. It's just that you are now using technology to enhance your delivery or your deliverables. Okay? All right. So AI helps us with smarter clinical decision support. Okay? Clinical decision support system is very, very key when you are managing your patients. So what does AI do? It helps you real-time analysis. It processes patient data instantly to detect drug-drug interactions, dosing errors, and contraindications. So the information you have, you feed it in, and immediately it's able to give you answers in seconds. In seconds. So you don't need to go to your BNF, you don't need to go to encyclopedia, pharmacopoeia, and all those things to come up with all the information, pharmacology textbook or whatever, MDES, name it. It gives it to you as quickly as possible. And of course, because you are an experienced person, you are knowledgeable in your area, you are able to put the information it gives you, you are able to make a decision, judge a judgment based on that. Then there are tools that are proving themselves over time. IBM Watson was put to test with professionals and it won over 80 or 90% of them. It won over 80 or 90% of them. Okay, we have other tools like Up-to-Date AI, Medscape, AI Assistant, and integration with your pharmacy management system. All these tools, you can bring them into your management system in your pharmacy, whether in the hospital or in the community practice, and you take advantage of these tools to gather quick information that you can use for a decision to deal with your patient. Okay, and if, for example, you don't want to go too far to all these other tools, you can use our dear ChatGPT, or you can go within ChatGPT, you can go to the GPT called PubMed and generate evidence summaries of latest guidelines for ward rounds and clinical discussions. So you can use these tools to also empower yourself with knowledge, prepare yourself for different scenarios so that when there's a need for you to contribute to discussions, you are not lagging behind. Okay? So you see, that's AI at work for us. We're talking about personalized medicine. Today, there's been predicted that a time will come, I don't know how soon that will be, that drugs will be produced for individuals. So you know a particular person, you know what his problems are, you can produce particular drug for that person. Perhaps we're going back to those days where we started producing drugs. I don't know how it's going to happen, but somebody predicted that we're going to be producing drugs for particular individuals. Unlike now that will produce metformin 500 milligrams for everybody, you might likely produce something for a particular person. Maybe we're going to use what's it called? 3D printing or whatever, I don't know. But somebody mentioned it, predicted it. Well, I don't know whether it will happen in our time or in the time of our children or our grandchildren. Okay. However, personal medicine is being promoted today. You want to treat an individual as that individual, not as a part of a group, a whole, individualized. Okay? So what does that mean? It means tailored therapy to those individuals. So you can integrate a patient-specific data, lab result, allergies, genetic markers, comorbidities to personalized medication therapy. You're not using a general knowledge this time, you are using the knowledge for this particular patient. Okay? Now, when a patient comes to see a doctor, right, and the patient complains about something, what the doctor is likely to do, or even if you are as a pharmacist, the patient comes to you, what you are likely to do is to look at the general information about the disease condition, general information about the medications that can be used, and come up with a judgment and say, okay, this can help you. With personalized medicine, what you do is look at this person's data, not just his complaint. You look at his data, his genetic configuration, his history, everything. You put all those information together and treat him as an individual. Whatever you are giving him is not from a general pool, is directly for him, well targeted to him. So with AI, this is made easy, especially with health record, you can access those information and make quick decisions that will actually help this person. You can also help with, including helping with patient prescription adherence, drug adherence. Okay? Now, what does it do? You do drug therapy monitoring to assess the patient assessment against patient parameter, medication reconciliation, ADR prediction. Machine learning today can identify what are the likely ADR that a patient can have, a particular patient, not patients, a particular patient can have as a result of whatever drug you are giving based on his genetic composition or whatever, or information you have on this person. For example, if you ask ChatGPT, what is the latest update on anticoagulant management in renal impairment, you get instant information. But this is not actually personalized medicine. But with this information, you can marry it with information you have about your target patient and see the difference you can make in advising the person. How about patient communication and education? AI can help you achieve this very, very quickly. I have a course, AI powered pharmacist bootcamp. One of the things I taught them is how to create patient education material in seconds. Audio, text, image, video. Right? With AI, you don't have to be skillful in all those things. AI can help you do it. We're going to do a practice on this actually. Okay, so you can convert complex information into simple information that your patient can understand. So imagine, for drug counseling, for medical care, you have been taught to speak a language that your audience can understand, right? Now, with artificial intelligence, you can say it in different formats. Now, I used to give this example. So when you are asked to talk about menstrual cycle, you're likely to just talk with all the jargons. Okay? I also shared this when I was speaking at the NAFDAC event. So you say all the things. But you can, if you are using AI, you can say it specific to a particular audience. Say it in a particular manner. So for example, there are different grades of knowledge. We have children, we have high school level, we have university graduate level, and so on and so forth. And we have professional level. So when you are speaking about menstrual cycle to professionals, doctors, pharmacists, nurses, and everything, the language you are going to use will differ from when you are speaking it, or talking about it to a 12-year-old. Not just a 12-year-old, a 12-year-old who has seen his first blood. What does this mean? The way you deliver that information will now be channeled or targeted or tailored to that particular person. AI can make you do this very, very easily. And this information that you have written in English can also be written in Igbo, can also be written in Yoruba, can also be written in Hausa, French, Portuguese, Spanish, or any language that you choose it for. So what it therefore means is, for example, as a Nigerian who cannot speak French, I can prepare materials and share them with people in Cameroon who do not speak English. And the information will be passed as it were. And this can be in text. We have AI that can translate your voice, your language. So I'm speaking in English now, you can deliver it in French. As I'm speaking to you now, it will be speaking in French. Or at least if it's recorded, it can translate it. It can do it in text also. What I've written, it can convert it into another language, even though I cannot speak the language. That is the advantage that comes with using AI. So for patient education, it's improved. There are Hausa people that can read Hausa but do not understand English. So if you happen to be, let's say, you're working in a community where we have this kind of people, you can convert the information into Hausa and pass to the person, and the person will read it, and you have communicated, even if you cannot speak beyond zone in Hausa, or Kedu in Igbo, or Bawoni in Yoruba. Do you understand? The second one is you can create leaflets. You can create illustrations. You can come up with banner, with poster, with flyer at the instance. And with this, you can create counseling notes. You can create educational material, even discharge summary in minutes, not hours. You don't even need to be a graphic designer to do it. I have designed several flyers without needing to reach out to graphic designers. So I'm saving myself 2,000, 5,000, 10,000, depending on how much the person charges. Okay? Then with AI also, you improve adherence. Because when you give clear, accessible education, medication adherence improves, patient compliance improves. At the end of the day, the outcome is also improved. Okay? We are going to practice this when we do the practical session. I do hope that you guys are learning one or two things in this. Now, about pharmacovigilance and research. This is also one of our core area. Okay? With AI, you can detect or get safety detection, identify adverse drug reactions, patterns faster than manual review. Imagine that you have reports, up to 100 reports, and you need to go through them. How long will it take you to go through them? But this same information, you can feed it to AI, and in less than 1 minute, it will give you some information that will be useful to you. Okay? For example, WHO's Vigibase uses AI to flag emerging safety signals automatically and inform the world about it. How about accelerating your research? So many of us, let me also share this quickly. You are young pharmacists. What is missing with most pharmacists is the fact that after school, unless it is compulsory, the continuing medical pharmacy education that we are supposed to do, professional development, except that we don't do anything academics, we don't do anything research. I want to encourage you, young pharmacists, to take this as a challenge. You will need it tomorrow. Nothing stops you from having your PhD before you get to 35. It is possible. One of the ways of getting this is research. Among my own classmates, I graduated 2001. I think only one is a professor now. Some are PhD, but only one is a professor. Many people are not going into all those things because you are pursuing money. Guys, there are opportunities for you when you build your research skill. So AI can also help you in that area. Now, when I say AI help you research, doesn't mean that you now give you a topic and to write a research writing for you. I don't support that. I support ethical research. But this is it. What do you do when it comes to research? You pick up a journal and you read page to page. Some journals are 14 pages, some are 30 pages, different number of pages. How much time will it take you to go through them? With AI, you can summarize that 15 pages into one page. You can get highlights about what you are searching. You can get highlights about their result and so on and so forth. I have a course which I'm working on, academic and research writing using AI. Those are the things I'm teaching in those. When it's out, we'll make it available to the world. But what am I trying to say? With AI, you can read hundreds of journals without you sitting down to read them one after the other. That is making life easy for you. Does not mean you're lazy. You're querying it to get information quickly. Okay? And there are tools like elicit.org that can help you do that. You can extract key findings from a vigilance report, and you can create presentation. By the way, this presentation that you are viewing was created using AI. It didn't take me 3 minutes to get all these slides ready. I've created them twice, each of them 10 slides. Altogether, the total amount of time it took me to create this particular slide, not the content of the slide first. The slide, when I have the content and I put the content there, the time it took me to create the content, this slide design is not up to 15 minutes, both of them put together. Okay? Not to 15 minutes, put them. Imagine that you open up your PowerPoint and you need to, even if you are copying and pasting, can you get everything done? Design properly like this, get image and everything in 15 minutes? No. That's AI making work easy for you, not making you lazier. Now, the time, if I was going to spend 2 hours or 3 hours, there's a presentation I'm working on. I sat down and I did a lot of, I was using Canva to create it. After some time, I abandoned it. I did not finish it up till now. I abandoned it. If I was using AI, that is done in seconds. That's what I'm trying to say. Okay? So it's to help you and hasten your work. Okay? So you see, you can query details. You can query information. You can query maybe 20 pages. Let me give another example about querying. I'm digressing a little because I want you to see the power of AI. I was given an assignment to come up with a 3-day workshop on a document that is 84 pages. If I was going to go through that 84 pages, I need to read it over a long period of time, get to understand it, and begin to extract. I uploaded it and I had chat with ChatGPT to and fro before you know what's going to. By the next day, I have 3-day program, agenda, slide presentation, everything ready. This will have taken me weeks, or at least 1 week if that's the only thing I did. But I was able to do it overnight. That's AI helping you and making life easy for you. So why fight it when it can make life better for you? I buy inventory management. We're talking about community pharmacy. I buy inventory management. You can use it for demand forecasting, predict drug demand patterns to prevent stockouts and overstocking or even expiry. Okay? You can also use it for cost saving, improve margins, reduce expiry losses through optimized inventory. Tools like Inventoro, Excel Copilot, or ChatGPT can be helpful in this area. How about customer engagement and chatbots? You can use AI to design FAQ, frequently asked questions, automated answers to commonly asked questions. You can create it and put it on your website, or you can even create it and create a chatbot, and when people ask questions of the chatbot, it responds to them. You can give health advice. Minor health guidance, medication information will be at patient fingertip. So you don't have to sit down to answer every question that comes. You just direct them to the bot, and they ask questions from the bot, and they get all the answers that they want. Only one that require more intense explanation, they reach out to you. So if all the minor problems or questions that your patients have been answered, why do you need again to waste your time doing that for them? So you see, you can free your time now for more other important issues that need your attention. Okay? Then how about appointment reminders? You can set all these things in WhatsApp, for example, the automation on WhatsApp that you can use, and people can get a reminder of maybe their medication or reminder of their appointments and so on and so forth. And we have tools like ManyChat, WordPress, VoiceFlow to help us do this. And I mentioned about health education and community visibility. Now, all these are applicable both for hospital and community, but you know, some of these things are mostly community at this age. When I was talking about clinical earlier, it's for clinical practice, irrespective of what you are practicing. But for community practice, health education is also very key. Very, very, very important. So what can you do? You can create content. ChatGPT can write your weekly health tips, daily health tips, as many things as you want to write. It can create images for you. Canva Magic can do that for you. Can design professional health posters instantly. Okay? You can build credibility. You can attract customers. You can promote preventive health practices. How about video creation? You can also create videos. I'm sure you have seen videos of babies that were rejected coming to Nigeria, or babies that they were asking, why are you working now, or why are you doing all those things? Those are videos, AI videos. And you see some AI videos, you will hardly differentiate whether they were created using AI or they were actually human models. And you can use all these things for health education and community visibility. When it comes to business, actually, many pharmacies do not do a lot, do not take advantage of technology, do not take advantage of a lot of strategies. How can you have a pharmacy and you don't have a list of your customers? Even those that come to do inquiry, many pharmacies don't take this information. If you have this, you can put them into a WhatsApp group, WhatsApp broadcast list, and be sending messages to them and be educating them. You are now building community. You are building a relationship with your community, which could build your business. That's a discussion for another day. There was a time I was teaching digital marketing to pharmacists, and I think I dwelled so much on this and get them to understand this. How about personalized adherence and patient loyalty? Okay, you can do smart reminders and outcome tracking. Okay, so I've shared a few areas in which AI can be used in pharmacy. Like I said, we're going to do some practical sessions. What are the tools, essential tools that you want to use for your practice as a pharmacist? So if you are looking at drug information, you can use ChatGPT, you can use PubMed Med GPT. PubMed GPT is inside of ChatGPT. I don't know whether it's science, and you get faster clinical decisions. Okay. Then, if you want to do patient education, you can use Claude, you can use Canva, you can use ChatGPT also. You can use ideogram. You can create leaflets, which will give you clear communication with your target audience. How about data analysis? You can use Excel Copilot. In Excel, there's a Copilot that's installed. You know, Copilots, Microsoft, all of them are the same one family. Okay. So what can you do? You can get information like sales trend and can use it for better forecasting. How about marketing? There was this time I was teaching and they said pharmacists should not do marketing, right? No, they said should not advertise, self-advertisement. It doesn't mean you cannot do marketing. Even patient education is a form of marketing, right? So we need to learn a lot of business. I used to tell people that that pharmacy management that you learned in school, one semester, 4 credits in it, it's not enough for you to launch a business, right? So you need to educate yourself, empower yourself. And today that we have YouTube, that's a university for you. We have so many people selling courses and consulting and all stuff that you can learn from. So you can empower yourself on marketing and you can do a lot. AI makes it easier for you, really. Okay? Now, when you talk about this marketing, that's another area where I am actually passionate about. How can pharmacists use their knowledge to build a business for themselves? You see, when you talk about pharmacy business, what comes to our mind is importation, manufacturing, pharmacy, community practice, right? But how about other things? I'm always against this belief that pharmacists are experts on drugs. When you ask a pharmacist, we are experts on drug. No. You are not just an expert on drug. You are expert on drugs, on health, on healthcare, and several other things. We take too much ownership of drugs that we fail to see other opportunities that we have as pharmacists. When you are talking about management of hypertension, for example, we have pharmacotherapy and we have non-pharmacotherapy. That non-pharmacotherapy, is it drugs or is the things you are using there drugs? No. So why not teach that also as a pharmacist? So you are an expert on the non-pharmacotherapy. So if you are an expert on non-pharmacotherapy, why limit yourself to only pharmacotherapy? I preach this a lot. We need to change our mentality when it comes to areas where we have expertise. Okay? Now, we can also go beyond just drugs. We can go into medical transcriptions. Well, let me not go too much into that. Let's stay on our path to AI. And AI can help you in any of these areas I'm talking about. So you can create a brand for yourself because not all of us will have money to start manufacturing. Not all of us will have money to start importation. Not all of us will have money to open a community pharmacy. But we can start with nothing. You can start with just your brain, your phone, and the internet on your phone and make a difference. A lot of pharmacists are doing this online, and we need more. I used to give reference to Aproko Doctor, see what he's doing as a medical doctor. You can use that platform to create several different things. He was able to create something, our doctor. He got how many thousands or millions of dollars from, is it Bill Gates Foundation also? Gates Foundation, I don't know. A lot of money. If you get that kind of money, will you trade away or trade it away? By what you do. Not just even making the money, you are making impact. You're touching lives. You're making a difference. Imagine someone that doesn't know some things about some drugs. You go online, you talk to them about the drugs, and they learn something. There's this pharmacist, Chubamam. I used to tell people that this is a pharmacist that stops people from taking drugs. What does she do? She helps with health education and look at alternative way to managing hypertension. She doesn't stop you from taking your drugs. But by virtue of the work she does with our clients, many of them were weaned off drugs by their doctors because of the no pharmacotherapy that she introduced into the management of their hypertension. Can you do that or can you not do that? Are you not trained to do that? Let me need to think in that direction. How about productivity? You can use tools like Notion AI, Gemini to create a lot of things for you and create automation. You can do a lot more. You can even create your own website. You can use AI to create a website. You can create, what's it called? Oops. You can use AI to create apps for you. You can do a whole lot of things using AI. Okay? So AI is out there to make a difference in our lives. Okay? So I said we're going to do some practicals. Before we go into the practicals, I want to share this. This is very critical. Now, I don't know how many of you have heard that people say, for example, when you use ChatGPT to write, that whatever it produces for you is robotic. Or sometimes you ask a question and what it gives you is not exactly what you want. This is where people are getting it wrong. Prompting. So prompt engineering is a skill in talking to AI to give you the desired result. In actual fact, prompt engineering is a new profession that people are earning up to $120,000 a year. It's a new profession on its own. Remember that we said AI too will create jobs, will bring new jobs. Okay, good. Now, so if you want to use AI, you need to learn how to talk to AI. I just did this simply. Is this a simplistic method? I have a more broad. I run AI Master Academy. I have a course that's, I think, about 2 hours teaching this. Is it 2 hours or 4 hours? I can't remember. Teaching just this one. If you get this one right, let me tell you, you don't need any other information, any other teaching about AI. Getting prompt engineering, you can use any type of AI tool because you understand how to talk to them. Okay? So you can define your role and say, for example, you are a hospital pharmacist. That is a role. You are a doctor. You are an accountant. You are a brand strategist. You are a marketing expert. Okay? Then you can give it the task. What is it you want it to do for you? You don't just say, write an email for me. You need to tell it to take a persona. You tell it to write the email and the type of email you want it to write for you. That is the task. You provide context, explanation. Okay? Then you also specify how you want the result to come. Okay? You don't just say, create this. You tell it how you want it to do. So we want to practice this and see how we can get AI to work for us in our different areas of pharmacy. But before we go that, there's this one more slide I want to talk about before we go to our next step. After the presentation, we'll go to the next step. Now, ethics. This is very critical. This is very critical. Earlier, we were talking about, I said you can use AI to build your research skill. And I said, I am not in support of people putting a topic into AI tool and it produce a write-up. Yes, that is not ethical. That is not research. That's a generation. If I'm writing a book, I can use that. If I'm writing a Facebook post, I can do that. But when you come to research, you have said you are searching. So search. Okay? So now, whatever information ChatGPT gives you, your judgment comes in. So you need to verify. Because sometimes AI can hallucinate. There was a time there's a book I wrote on prostate health. And I was talking about exercise. I say you need to exercise 75 minutes 2 times a day. And I said, no, I disagree. What I'm familiar with is 30 minutes 3 times, 30 minutes 5 times a week. But it says 75. I had to go research it. And I saw an authority that said, yes, you can do 75 minutes 2 times in a week. So you see, I've verified it and I can use that information as it were. Okay? So you need to verify. Then patient information, you need to protect it. Those information are available to you in confidence, right? Then, of course, you need to preserve your professional judgment. Whatever information it gives you, you need to use your own judgment to come up with your final decision. So your judgment still comes. So this word says AI is a powerful calculator. For you must know the maths. you must know the maths. It's the maths that will guide you on using the calculator properly, right? Now, let's go to ChatGPT, maybe ideogram. Perhaps I will check if my Gemini is there, see if we can create one or two things and do some practicals and see how powerful this tool could be. Okay, so let me, okay, here we are on ChatGPT. So, well, let's talk about drug-drug interaction. I'm going to create a scenario. Okay, my patient is on the following medications. So metformin, diclofenac, ascorbic acid, metronidazole. I'm just putting some things wrong. Okay. Is a diabetic of over 15 years, but has poor compliance. Okay. He is moderately obese and a smoker. Not sure if he drinks alcohol also. Okay, so this is a scenario I painted for ChatGPT, right? Aha. So I can say one, check for drug, check for any interactions. Okay, and contraindications with the medications. Okay, number two, I can ask how do I counsel? I'm just trying to show us what is possible. There are some of these things you can manage by yourself. I'm just creating a fictitious scenario. Can I counsel this patient to improve his outcome? Okay. So let's just ask these two questions. Let's see what it's going to do for us. What's happening? Sorry, network is. Aha, what's wrong with you before? Okay, so let's see what ChatGPT is going to give us as a response. So you see, it has, first question I said drug interactions and contraindication, right? So it has listed out the drugs, it has listed out this condition and everything. Then see potential interactions, metformin and metronidazole intentionally produced together. Potential for lactic acidosis. So do you see? Metronidazole can increase metformin plasma level by reducing its metabolism or excretion. Risk increases with poor kidney function or dehydration. Monitor renal function and watch for signs of lactic acidosis, which are fatigue, muscle pain, rapid breathing. Metformin and diclofenac increase risk of kidney injury plus lactic acidosis risk. You see? Metronidazole and alcohol, if he drinks, there's like reaction. I'm sure we're familiar with this one. Diclofenac plus alcohol, if he drinks, GI irritation and bleeding. So do you see? Ascorbic acid and metformin, minimal clinical concern, so you should know a problem. Diclofenac and diabetes, potential, possible fluid retention and BP elevation. So do you see all this? It has given you what is the interaction and the clinical concerns. Okay? Now it talked about even the contraindication and the cautions to take. You see, contraindicate, metformin is contraindicated is significant renal impairment, dehydration, heavy alcohol use, or unstable liver function. If this information is available, remember we said if you have the electronic health record, all these things you feed into it, so it's going to look at all the parameters and come up with a decision. So it's only the information I gave it here that came up with this. If I had given it about the liver function or the whether the person has cardiac failure or not, whether the person has a kidney problem or not, or whatever, I'm able to give full information. It's going to give me more specific response as related to this. So you see how AI can be helpful. See diclofenac and everything. Then the counseling. How do we counsel? It's giving me how many portions of counseling? 3, 4, 4 different areas of counseling. The first one is address diabetic control, emphasize medication adherence, explain long-term and this and this and this, encourage this and this. The second one is lifestyle modification, stop smoking. If alcohol is confirmed, counsel him to stop. Weight management, because I say he was obese. Okay? Then medication use guidance. You need to give him information about how to use diclofenac, use for shortest possible time at the lowest effective dose, metformin, metronidazole, then see monitoring and follow-up. See all this advice that's given me. Now, when I'm advising my patient, I'm able to give more information. Imagine, let's be frank to ourselves. Will you be able to likely remember all this information that he gave us? For the little amount of time you have, for a large number of patients that are waiting to see you. Now, with this, it gives you this information in less than 4, 5, 7 seconds after typing the information. Now you can just look through it. You don't even have to read everything. Just look through it, pick up information, and use it to talk to your patient. Of course, as you use it, you're also learning. Don't forget. As you use it, you're also learning, and this thing stays deep in your own subconscious and your knowledge base, and you can use it even offhand some other time. So when you are confused about even some things, instead of going to BNF to ask, you can also check here and get this thing sorted out. So do you see? Now, for this patient now, we have been able to come up with a counseling pattern for this. Okay, now, let's say we want to create patient education for people like this. For people like this. Okay, so I want to create patient educational materials for patients in this category. Okay? I don't even want to even ask you to create for me. Look, I'm going to ask you, what kinds of materials would you advise? So do you see, I'm trying to take advantage of the information available to it to give me advice. And see, it's going to give me different types to advise. So you see, illustrated leaflets and booklet, counseling posters and infographic, diabetic cell management diary, a WhatsApp or SMS education series, short video clips or animation 2 to 3 minutes, diabetic care starter pack folder, group education, and now see all the things it has given me. See the topic I can cover. Do you see? See the topic I can cover. See the design languages I can use. See the structure I can have. Just one question, see the whole thing that it has given me. Okay, now I can ask it for the patient earlier discussed. Can you give me a prompt to create a flyer? A counseling flyer for him. Okay, now we're going to go to another tool. What's wrong with this? So I went to another tool to see if we can create the poster. Now, this tool has a limitation in that the information is going to give us will may have some spelling mistakes, but it doesn't matter. We're just trying things out. If I want to do it without spelling mistake, I know what tool to use, but we don't have that luxury of time now to get that done. So here's the tool. I've come to ideogram. It's a tool you can use to create things. So I'll paste this, which I have done. I want the poster size. Let me change the poster size to this, 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 this. I think I want this 3x4. All right. So I would now click and generate whatever it gives me. So it's creating it. So it's going to create this poster for me in how many minutes? I'm not a graphic designer. I don't know how to create anything, and it creates it for me. Here we are. Can you see? This is a poster. Take charge of your health. Live better with diabetes. So do you see? This is a glucometer. Stop smoking. Stop eating maybe junks. Do exercise. Eat vegetables. Take your drug. Without saying anything, you can see this. Then see all this. Take your medicine every day. Don't skip doses. Whatever, whatever, whatever. Can you see? So let's see, what is this? It's a different pattern. This another pattern. This another pattern. Does it make any sense to you guys? So you see, you're not a graphic designer, but with AI, you have created this poster, which you can print into paper or you can share on WhatsApp to your target patients. So do you see all these things in action? Okay. Let me try something. That's my Gemini. And Gemini. Okay. So you see how these things go, right? I'll still go to Gemini. I want to jump to other part because I think our time is fast spent. I'm getting some warning from this side. So let me try and conclude. Now, I talked about a pharmacy business. So I run a community pharmacy. Okay. And I intend to run a loyalty program in line with the ethics of practice. In line with ethics, the ethics of practice. Can you give me some suggestions? So those of you who are in community practice, now you have somebody, a business consultant that can help you. I'm not using I mentioned about prompt, right? I'm not using the prompt style to work here. I'm in a hurry, so I don't want to waste a lot of time bringing every rule into play, okay? All right. So you see, core principle, ethical pharmacy loyalty. So you see, patient benefit first, no inducement or misuse or overpurchase, focus on adherence, education and wellness, transparent terms, respect confidentiality and everything. Comply with Pharmacy Council, PCN, and NAFDAC guidelines. So you see what you can do, ethical and loyalty programs, medication adherence club, community health ambassador program, digital wellness loyalty card, health screening loyalty plan, know your health education pass, senior citizen or chronic care loyalty. So do you see the different things you can bring into your practice? You'll be serving your customer, giving them something in appreciation for their loyalty, and of course, they'll continue to patronize you. Now, patent medicines cannot do this. For pharmacists who don't have access to this cannot do this, but because you have access to this, free business consultation without paying a dime. I am a management consultant. Anytime you ask me to give you advice, you pay consultancy, and I will give you the advice. Now, with AI, you don't need to spend all that money. So you see what it has given us. Okay, and for those of us whom I say young pharmacists, why not take advantage of the internet? Take advantage of the fact that you are not just a expert on drugs, you are expert on healthcare, you are expert on health itself, drugs and everything. Why not create something online? So I want to build thought leadership in the AI mastery, sorry, AI powered boot camp. I taught this on how to do Facebook and all platforms, how to do thought leadership. So I want to build on uh, thought leadership on health as a pharmacist. But, oops, but I don't have an idea on what to focus on. Okay? Idea on what to focus on. Can you give me 5 areas that have high potential? I like money. For monetization. I'm sure you guys have already seen that I like money. Of course, ethically, right? High potential for monetization, but also give high value to my target audience. I say 5. Let's see if you can give me 5. Excellent. By the way, I'm using the free version of ChatGPT. I'm not using the paid one. I have a paid one right here on this laptop. I have a paid account right here on this laptop. I'm not using the paid account. I use the free account. And the reason I use free account for my training is because it's expensive to get the paid one. Paid one is $20 per month. How many of us can pay 32,000, 31,000, or any amount the exchange rate is to access this tool? The free is also as good. The paid gives you enhanced result, but the free is also as good. So see, thought leadership, it has given me medication adherence and lifestyle management for chronic diseases. And you see, it has given me monetization potential and tells me why it works. Then what are the content I can put online? This is not interesting. Preventing health, everyday wellness, medication safety and rational use, personalized pharmacy and health tech integration, men's and women's health, lifestyle, sexual, hormonal. You can choose. Now, you don't even have to depend on this. I have expertise. I'm teaching you a new one now as a sleep therapist. Okay, no. I have expertise in helping my patients undo insomnia. Insomnia. Yeah. Where's the O? Insomnia. How can I take this skill online and create a brand for myself and also make money doing this? I know you people like money. Not only you, you need money actually, but don't get money at the expense of your patient. I don't advise that. Okay? Don't make money at the expense of your patient. A worker is, a laborer is worthy of his wage. That's what I preach. So, you see, what am I trying to say? Anywhere you want it, just talk to it and you get it. We teach all these ones and how to get all these things done in the AI-powered pharmacist bootcamp anyway, but I'm just trying to give you some of those things we teach there so that you can start using it. If you are wise, you can even build something out of this, okay? I was teaching a class, a different class actually, and I was using asthma as an example. In the course of the class, I decided to create a product on asthma. I'm looking for time now. I'm so busy, I've not had time. When I have time, I'm going to pull out all those things, create a package, and begin to sell something on asthma. And I'm just practicing with my students because I'm using it to teach. Now I've gotten an offer on my table, which I'm going to use and create something and sell. Okay? But that product will be helping the people that will buy it to solve a critical problem that they have. And by the way, the sky is wide enough for everybody to fly. Everything I'm talking about is ethical because it's education. You're teaching. You're not selling prescription only drug. You are not telling them not to meet the professional. You're not telling them to see their doctor. You are giving them those help that will help them get out of their situation. I have now, as a management consultant, I can create something targeted at community pharmacists for digital marketing, and I'm helping them solve problems. As long as you have something to solve problem with, please take advantage of the internet, take advantage of AI to get it done. So you see, define your unique identity. You see, sleep health pharmacist. So who is going to be the sleep pharmacist? Somebody shared this in Gombe. There's a lady pharmacist that came from Delta State and talked about this. Okay? You can use AI to build this business from scratch. See, that's even giving you a name, sleep health pharmacist. So imagine that you are online and say, I am the sleep health pharmacist. Anybody that has problem with sleep, they will remember you. Many pharmacists, almost all pharmacists can give advice about sleep, but only you will say you are the one that knows about it. When anybody else come and say, I know how to do sleep, you are number one. You are the one that will take it. I mean, all of you have the same knowledge in your training, but you have singled out yourself for a particular result. Is this thing sticking? Is it making sense? Oh, well, I pray it does. So you see, possible branding statements, target audience that you are going to have, the steps you are going to use in building this. So you see, you can call yourself the Sleepwise pharmacist, Dr. Sleep pharmacist, Rest Well with Gabriel. That's me. He knows me. ChatGPT knows me. The Sleep Reset Hub. Now you can come up with a platform. Where do you want to stay? Content. Which content are you going to be shared? What are your content pillars? How do you make money from this? You see, give you an example. You can do one-on-one consultation. You can create digital products. You can do a group sleep reset program. You can do brand collaborations. You can do affiliate. A lot you can do. You build a funnel. This is what people pay 22,500 for. You can get it for free. Anyway, it's my pleasure to always teach all these things so that you can learn from them. I think we have done so far. I wanted to see if I can create a video, but I don't know whether I'll be able to do that now. Let me try. Okay. Create a video of a pharmacist in let's actually call it a shop. Forgive me, I'm going to use shop. In a pharmacy store. Counseling a diabetic patient saying, this metformin is to be taken okay, no. Take 2 tablets of this metformin thrice daily. While this what now? While this what is the other one? What's happened? Hey, Gabriel, pharmacist, you've forgotten Let me just move after this. Can you imagine? I can't even remember. Gabriel. All right, please. Why this vitamin C is to be taken um 3 times with food. I'm just giving a rough this thing with food. Okay. I don't know why it's sulfonyl. Yeah, that's sulfonylurea, the common one. Glycoside, and not the glycoside, that one.
Glabeclamide.
Glabeclamide, that's what I'm trying to. Glabeclamide, that's what I'm trying to remember since. But don't worry, I'm just giving a sample. This number doesn't matter, okay? Thank you for helping me out, please. So you see, this is a video. I will not tell it. Go create it for me. Okay? Now, why that is ongoing, so what I'm trying to say generally is when it comes to using AI, ensure that you are not left behind as a pharmacist, right? Ensure that you are not left behind. AI is here to help you. As you could see from what we have talked about, AI is here to help you. It is not to replace you. Now, imagine that you run a business, a pharmacy business. Somebody else runs a pharmacy business 200 meters away, the same community. You are able to use AI to draw up a loyalty plan. The other person does not know about AI and could not draw up a loyalty plan. Now you are having better relationship with your customers. Your customers, rather your patients or clients, are telling others about how you are helping them. What happens? They leave that pharmacy, who is not doing much for them, and come to you, who is doing a lot more, because AI helped you with ideas, packaging information, and everything that you share. Okay? There's something I wanted to do. Please forgive me. Let me just do one more. I enjoyed that part actually. Okay? Right? A patient, write a simple explanation on how Yusuf metformin helps a diabetic patient. 100 words. Again, so I want to do something. Okay, this is it. Metformin helps diabetic patient by lowering this sugar and the rest. 100 words. Now, remember I said you can translate the other languages? Okay, write it in Pidgin English. Why is doing that? I'll ask you to write it in Igbo. So you see, let's start from the first one. Metformin helps diabetic patient by lowering the amount of sugar, glucose in the blood. It works mainly by reducing the amount of glucose the liver releases and by making the body cells more sensitive to insulin so that they use glucose more effectively. Let's go to the pigeon. Metformin, they help person when get diabetes by making sugar for body not too high. It works by stopping liver from producing too much sugar, and it also make body cells sabi use insulin well. So sugar will enter cells instead of the plenty for blood. I mean, you can reframe it depending on how it is. But I say write it in Igbo. Unfortunately, I cannot speak Igbo. Write in Yoruba. So I wish, let me try. Metformin na enyere ndị ọrịa sugar, diabetes, site n'ibelata. Please forgive me. Let me not crucify the language I cannot speak. But let's see. Yoruba. I'm doing all languages so that they will not say I'm partial. Right in Hausa. Metformin ran àwọn aláìsàn àtọ̀gbẹ lọ́wọ́ nípa dídín ìpele ṣúgà nínú ẹ̀jẹ̀ kù. Whatever. Please forgive me. But I mean, for those of you who understand the language, you could decipher what I'm trying to say. In Hausa, it says, Metformin na taimaka wa marasa lafiya masu ciwon sukari ta hanyar rage yawan sukari a cikin jini. So do you see how it's? I want to do this. I enjoy doing this part because it brings this home. Imagine that you are in Kaduna, you speak Igbo, you don't understand any bit of Hausa. Now you are now an educator health educator in Hausa because ChatGPT can come to your help. Okay? That's what I just wanted to share. Okay, let's go back. Since we are still here, let's go back one more. Let's check our video. Oh, interesting. Our video is ready. You see? Talking about prompting, I say a pharmacist, right? But I did not say which kind of pharmacy. Is it a black pharmacy, the Nigerian pharmacy, or Igbo pharmacy? Default is Oyibo, but don't worry, you can, when you are doing your prompting, remember I said your prompting has to be very clear so that it can give you the result. But no problem. What matters is
2 tablets of this metformin thrice daily, while this vitamin C is to be taken 3 times with food.
So do you get it now?
2 tablets of this metformin thrice daily, while this vitamin C is to be taken 3 times with food.
So do you see now? Health education. Right. Health education using video. This simple education, you can do several. I taught it in the academy. You can do several and teach something over 1 minute, 2 minutes, or any number of minutes you want to do. All right. Okay. So we are getting to the end of this presentation. I know I've taken a lot of your time, but I'm sure you're happy you'll learn something. So what's your next step forward? Start small. You don't have to know everything. This video now, someone, how did you do it? Don't worry, it takes step by step. Even people who join my class, it takes them 30 days to go through the whole course, okay? Build a community, right? So you start with simple tasks, build a community. Your peers, you can come together and let's talk about this AI. Let's build AI, right? You can also iterate. You try, refine, trade, refine, keep teaching yourself, and you get it, connect and grow, okay? One of the ways you can connect and grow is to join us in AI Mastery Academy. Join our communities. We have free communities. We have paid communities that you can join. Now, let me remind you once again, AI won't replace pharmacists, but pharmacists using AI will replace those who are not. Thank you very much for your time. Moderator, I'm done.